Welcome everyone to the College of Public Health and Human Sciences Research Seminar. I am Carrie Lynn Sukuma. I'm the Program Director for Health Promotion and Health Behavior. We have lots of folks in the room, but those of you who are joining us by Zoom, please make sure to enter your questions in the question and answer box, and we will make sure to read it out loud so our presenter can answer them. I think this person does not need an introduction, but I am here to introduce Dr. Brian Primack, who is here to present his work on social media and mental health. Dr. Primack has been using all of his research in introducing to us how we can do mental health, how we can strategize social media so we can better our mental health. He has been working in this area for over 20 years. He developed the Center for Media Research in Media, Tech, and Health at the University of Pittsburgh. And he's recently written his book, You Are What You Click, How Being Selective, Positive, and Creative Can Transform Your Social Media Experience. It was also shortlisted for the next big Idea Book Award. So I'm very excited to introduce to you our Dean.
Hey, great. Thank you so much, Carrie Lynn, and thanks, Marie, for inviting me, and for all of you for coming, those of you in the room, as well as those of you on Zoom. I would like to start with a little bit of a pretest quiz game. I'm going to ask you 10 questions, and I'd like you to try to, if you don't mind writing down just what I'm not going to tell you the answers until the end, but I'd like to see what you know and what you don't necessarily know and what you have learned over the course of the talk. So, when was the term social media first used regularly? Was it A, at the time of the invention of the printing press in around the 15th century? The early 1700s, the late 1800s, the mid 1990s, or the early 2000s? Sorry, you don't have much time for this because this is eating.
The letter down or right?
You could just put the letter down. Yeah, because I'm going to have them at the end and you're going to be able to test yourself. Okay, number 2. What is the leading cause of disability worldwide? And I have disability underlined. Heart disease, and I did make these A, B, C, D, E, if you can see. Is it atherosclerosis A? Is it B, back pain? Is it C, cancer? Or D, depression? Or E, exercise programs improperly followed? Okay, number 3. Since 2000, the rate of suicide in the US has decreased 5%, stayed about the same, increased 10%, or 20%, or 30% in the last about 20 years. 2000. Number 4, in a major national study, using this many social media platforms in an average week was linked to the best mental health. 0 to 2, 3 to 4, 5 to 6, 7 to 11, or 12 or more. Number 5, which of these celebrities recently stopped using social media? Was it Ariana Grande, Tom Holland, Lionel Messi, Elon Musk, or Oprah Winfrey? Number 6, there are 10 of these, sorry. But hopefully it's fun so far. Okay, what was the Oxford English Dictionary's 2015 word of the year? And these are your 5 choices. Number 7, which of these is not one of the big 5 personality characteristics? That's right. Personality psychologists in the room are probably at an advantage here. Number 8, who wrote the 1961 short story Harrison Bergeron? relevant, believe it or not, to our discussion today. Kurt Vonnegut, Truman Capote, Sylvia Plath, Robert Heinlein, Philip Roth. Number 9, imagine an average young adult. So I'm going to say, because you're scientists, you're going to say, well, what's young adult defined as, right? Say 18 to 30. What percent of their social media contacts have they never met in real life? And then last question, number 10, what is the pinnacle of the social media pyramid? And this one I totally forgive you for not knowing. But take your best guess, because you haven't seen this before. Okay, so with that, I'd like to go ahead and start by answering one of those questions immediately. The term social media was not ever used until 2004. And the reason that I find that kind of interesting is that today's world is very much based in a lot of ways on social media. We've all got it right in our pocket right now, or right in front of us right now. And 20 years ago, not only did we not have that, but we didn't have all of this. There weren't 4.62 billion people in the world who use social media 20 years ago. There were 0, or pretty much 0. And this is 58% of the world. There were not 5 billion people who use the internet. There were not people who spend an average of 7 hours a day on the internet. That's the average, 7 hours, 6 hours and 58 minutes. Sorry, don't want to exaggerate. The percentage of users accessing the internet via mobile phones is over 90%. Now, why is that important? Because there is something that is different about using something that is always with you versus something that is maybe stationary somewhere. People were very concerned in the 1950s. Oh my gosh, what is television going to do to people's minds? And at least it was in one place. It was on at one time from 8 to 11. There were 3 choices. We did not have any idea what was coming. So the growth of social media has gone from 0 to about 4.7 billion. That was data, the 4.62 from January. So it's already at 4.7. And average time on social media is about 2 to 5 hours per day. So that 7 hours was internet, which includes some non-social media. But depending on who you are, your average is between 2 and 5 hours. And the frequency is very high because it's right there with us. People, I'm sure, recognize this. When you go stand in line for something, that's what you look at. When you go to the restroom, I've seen a lot of people standing there at the urinal, opening their, I mean, that's what you do. Okay, so what does this mean? What this means in terms of the human experience is that if this is now, and this is when we became Homo sapiens about 200,000 years ago, this 67,000 years ago is the first time that there were arrowheads made. This is when humans crossed the Bering Strait. This is when around 11,000 years ago, humans settled in the Fertile Crescent and started a lot of, the society we think of as modern society. And then there literally is not room for me to put where social media comes because it's so incredibly close to now. In fact, what it turns into is about 0.01% of the human experience. So for 99.99% of being human beings, this is what the world looked like, approximately. For about the last 0.01%, this is what the world is like often. And that is going to, I think, affect the human experience as well as human health. Okay, now let's shift a little bit to a slightly different area, the area of emotional health in today's world. And then after that, we're going to talk about, is there a relationship between the two at all? So, most Americans are considered lonely. If you go to England, there is actually a loneliness minister. Ministers usually have been for things like housing, like defense, but now their most recent one, our most recent new cabinet post was Homeland Security. Theirs is loneliness. Depression is now not only one of the leading causes of death and disease in the United States and the world, it's actually the leading cause of disability. In 2017, this was big news because it passed back pain for the first time. Back pain had been the leading cause of disability. And so if any of you put that for your answer, you would have been right before 2017. Now it's depression. Interestingly, not heart disease, not cancer. Wow. Suicide is at an all-time high in every age group, doesn't matter what you look at, teens, older Americans. And in fact, you can look at it here. Over the last 20 years, you can see that suicide is up over 30%. Accidents are up even more, and a lot of those are mental health, right? A lot of those accidents are probably suicides, or they're related to one of the biggest, that's right, actually the phone itself, or they're related to substance use, which is often a surrogate for mental health issues. The things that have been going down substantially are all the things that we've been working really, really hard on. You know, so hooray for us. We really are making significant strides with regard to heart disease, stroke, cancer, and even chronic respiratory disease, tobacco use. But here's a very different story. Okay, so the question then becomes, and the question that my research group started asking, I guess about 10 years ago, it is accurate that we've been doing media and health for 20 years, but we started looking at totally different media because there was no TikTok, there was no Twitter at that time, you know, so we were thinking about advertising, we were thinking about tobacco industry marketing, et cetera, et cetera. It was a slow progression, but we started looking at what was going on in terms of social media and what was going on in terms of mental health. And we just wanted to know, is there any kind of relationship? And when we did this study, which involved 2,000 young adults ages 18 to 30, nationally represented, and all the things that you're going to see here in terms of the data are weighted with survey weights. They also are controlling for 13 different demographic variables that are sort of standard in studies like these. And what we wanted to look at was, okay, if we put people in 4 buckets, how much social media do they use? Do they use a lot of social media? Do they use a little social media? Do they use somewhat in between? This is about data were collected maybe 7 years ago now. So the highest quartile was about 3 hours and up. Now it would be more like 5 hours and up. This quartile was about 40 minutes and below. And then these were somewhere in the middle. You know, do you use like an hour, maybe 2 hours, maybe 3 and above? That kind of thing. But we just divided a priori, we just decided, look, we're going to divide into quartiles, whatever we get, because we really just want to look at the overall relationships. And then we looked at the odds that that person was depressed. And our hypothesis, very carefully derived and very specifically in the paper, was that we were going to see a U-shaped curve. Because, you know, it's probably pretty normal to use social media, you know, a certain amount, and you're getting benefit from it. I mean, good Lord, the word is social is right there. And don't we know that social experiences, you know, protect us from depression? Absolutely. So we thought that if someone is maybe in this quartile using almost nothing, they're not gaining that positivity. So their odds of depression might be higher. These folks, more normative, they're probably going to be the bottom. And then these people, you know, if you're using a whole lot, maybe you're missing out on other activities. This is what we found. So it wasn't that just the line, it was how straight the line is, how statistically significant it is. There was no curvilinear component at all. There was no leveling off, you know, no matter how we looked at these data. But it gave us a really big question, which is what comes first, right? Because just because, and we talk about this all the time, you know that social media, among people who use a lot of social media, they also happen to be depressed. That doesn't mean that one causes the other. So for example, that could be the case because being depressed, people who got depressed started to use more social media, right? They just didn't go out as much. And so they decided to log on to Instagram and Snapchat and Twitter more. On the other hand, it could be that by using more social media, there are actually pathways that might make them more likely to be depressed. We really didn't know, so we did the first longitudinal study. And the reason, you know, I don't know, it's very confusing. It's very hard for me to understand when studies come out, how much press there's going to be. Because when this study came out, there was a ton of press. New York Times and Washington Post and Paris and, you know, all this kind of stuff. And I was like, guys, it's cross-sectional. It's not that, you know, I really don't know. Now, this study came out longitudinal and there was nothing. Now, it was an interesting time in history. It was December 2020. There had just been an election. So in we have these elections, and there was this odd election and there was a lot of contesting and et cetera, et cetera. But also there were the first COVID shots being given out. I mean, there was a lot going on. What we did here was we said, okay, same thing, quartile of social media use, but we are going to start with 1,000 people who are non-depressed at baseline. Everyone's not depressed. So people using lots of social media, but not depressed at baseline. People using just a little social media, not depressed at baseline. And then we're going to see the association between the category of social media use and whether they became depressed over 6 months. And this is what we found. Here, definitely a linear trend, highly significant, and as well as a little bit even of a curvilinear component. So what you see on average, for example, is that these people perfectly happy at time one who were using a lot of social media, you could predict that those people were going to be 2.5 to 3 times as likely to become depressed, according to the PHQ-9 is what we use to measure depression over the course of that study. So what this means is that this direction does seem to hold. And then interestingly, in that same study, and the reason why we actually thought it was a more important study than the last one that got all the press, we showed that there was no relationship the other direction. When we looked at people who at baseline were depressed or were not depressed, there was no difference in how much social media they started to use over time. So we were starting to get at the chicken and the egg issue. Okay, so why is this potentially the case? What is the pathway from using more social media to potentially being more depressed? And by the way, the other major outcomes that we've looked at in this area and get exactly the same results for are loneliness, which I will talk about a little bit later, and anxiety. A lot of people ask about that. I should probably show it sooner, but just wanted to sort of give you that initial heads up. Okay, so one pathway is what we call opportunity cost. If we are doing this 7 hours a day in a social situation where, and you see this all the time, I don't have to show it to you here, you walk outside and you see a group of people sitting around and everyone is immersed in their own device. This would normally be a social situation. Using social media isn't necessarily going to be a social situation, even though that word social is right there. It's a little bit of a misnomer. Another issue is that of the highlight reel, that of believing, because people on social media are very, very easily able to curate their lives, almost like an advertisement might. However, it seems very real, doesn't it? Because you know that person and they're about your age, or they're interested in the same things that you are. So it's potentially even more powerful than, say, a model. Because, you know, if I'm looking at a magazine and I see, oh, there's Brad Pitt and he looks so great, I know it's Brad Pitt and I know he's being made up and et cetera, et cetera. But what we often see on social media is this picture, whereas we all sort of feel a little bit more like this every day. So the question becomes, wait a second, couldn't there be positive also though? I mean, aren't there things that, you know, could be valuable? All the creativity, all the interesting stuff, all the connections. And this is where the idea of the social media pyramid came from, is, you know what, we had the same issue 30, 40 years ago when we were trying to deal with a lot of the processed foods that were coming out. There were studies, every study that came out was carbs are bad for you, fats are bad for you, saturated fats are even worse for you, trans fats are even worse than that, et cetera, et cetera, et cetera. And what we eventually needed to do was do a little bit more nuanced study to say, you know what, this is more concerning, this is less concerning, there needs to be some moderation, but nobody really knows what is part of the social media pyramid. How do we use social media in a similar kind of way? What is the fiber of social media, right? We did these studies and said, oh, fiber's good. You know, we now understand that. This particular kind of omega-3 fatty acid may be good. This kind, the trans fat, may not be good, et cetera, et cetera. How could we do that same kind of thing? By the way, it didn't have to be a pyramid. You know, this was the food pyramid, but now they use choose my plate, right? So it doesn't have to be a pyramid. In our case, it did become a pyramid because that's just what sort of worked. Okay, so the base of the pyramid that we looked at, and I'm going to show you some research to demonstrate where and why this came from, is that we do need to be selective about the social media that we use. And that doesn't necessarily mean just cutting out time. I mean, certainly the amount of time you use something is an important factor. And I guess if you're using less, you may be more selective, but it's deeper than that. Because in our case, selective is really active selection. So let me give you an example of when it has nothing to do with time. We did a bunch of studies that instead of looking at the independent variable of how much social media did you use, we used the independent variables of how many different platforms do you use, even controlling for the time spent on social media. So what that means is that when I show you what we see up here, you're going to see people grouped into 4 chunks, the people that used 7 to 11 platforms in an average week, versus the people that used 0 to 2 platforms, 3 to 4, and 5 to 6, controlling for the amount of time. What that means in your head is sort of like pretend each of these groups, because we took that out of the equation, each of these groups is using the exact same amount of social media use over time, 2 hours, say. So I might be in this group. And by the way, is that hard? You think 7 platforms? No, it's not that hard. You know, I mean, I've used 3 today alone. People often say, well, I need to be on Facebook for my friend, for my family. I need to be on Instagram and Snapchat because that's what most of my friends do. I need to be on Twitter for news. I need to be on TikTok because that's how I do fun things. I really like Pinterest because I'm a crafter. Oh, yes. And, I also really like Reddit because Reddit has some really cool subgroups and information. That's 7. And I haven't even mentioned, a number of other very popular ones. Now, why do we have 7 to 11 here? Because when we did the study, we only asked people about the top 11 platforms, because at the time of the study, that accounted for 96% of all social media use. And we didn't want to go into like 40 different platforms and increase respondent burden for that extra 4% that we didn't really think was going to be that essential. A little methodology, thing. Okay, so number of platforms, odds of depression, boom. The people who used 7 to 11 platforms were 3 times as likely to be depressed as the people who used 0 to 2, even though these people are all using the same amount of social media. So what this tells us is, okay, there's an example of selectivity that we can put into the social media pyramid to help the people that we are trying to help. When we look at platforms and anxiety, same thing, but different outcome, same thing. And even a little bit of a real spike here. Wow, a lot of anxiety. Okay, where does this come from? Well, every platform, and by the way, we didn't know what the answer was going to be. And in the paper, when we wrote it up, we said hypothesis was not sure. Because it could have been easily that, these people are less anxious because they're getting so much good information from the world. They're so connected. They know exactly what's going on because they've got so many different sources. But in retrospect, what we're trying to do is figure out the why. One of the reasons for the why may be that each of these different worlds is its own microcosm. Almost anthropologically. Here is an article that is saying, if you use Instagram, these are the 32 tricks and features that you should know. These Instagram story hacks will save you time and make you the best storyteller in town. No pun intended. But what if you don't know those? Because you're on 8 different platforms and you're not like digging in and you don't know the inside story. If you're on the Reddit overall platform, it is composed of thousands of these mini communities, all of which are very interesting and a potential way that you can connect in a really positive way to people who have similar interests. It's a great thing. But each of those is its own little idiosyncratic world. And if you don't know the right lingo, you're more likely to make a gaffe. You're more likely to be blacklisted. You're more likely to have some kind of an argument or a problem that is going to significantly increase your difficulty. So this article talks about how Wall Street Bets is the famous part of Reddit that you may or may not know about that has been responsible for a lot of the stock market turmoil recently related to certain companies that were going under. And on this platform, everyone got together and said, hey, let's all buy this because a bunch of people are shorting it. Complex financial issues. Bottom line is, if you don't know what the term YOLO means and you don't know what diamond hands are, and you go on there and you start talking and making things, you're going to have problems. It's not going to be a positive experience. You are going to be more likely to have some kind of a problem, a fail, a gaffe. Take this. So the answer to that question that I asked you at the very beginning is this. In 2015, the Oxford English Dictionary, for the first time in history, their word of the year was not a word. It was this emoji. Now, why? And why not just a smiley emoji or, the poop swirl emoji, whatever? Well, because the laughing while crying emoji can mean almost anything. On one platform, the laughing while crying emoji might mean, oh, that's so funny. You've really made me laugh. On another one, it can be very sarcastic and say, I'm laughing at you. On other ones, it can mean totally different things. So this was one of the reasons why the Oxford English Dictionary said, this is a really, really interesting piece of communication, because we really don't know exactly what it is. And it exemplifies how, if you're using lots and lots of different platforms and you don't really know any of them very, very well, you might have more difficulty. It's almost like being in high school and trying to be really, really good friends with 8 different groups of people. If instead you're friends with a couple groups of people, you might be more likely to understand those folks, to have shared experiences, et cetera, et cetera. Probably not the greatest analogy, but something that we thought of nonetheless. Okay, another issue with selectivity. Who do you interact with on social media? Well, to our surprise, when we looked at these 2,000 young adults, ages 18 to 30, and we said about how many of your social media contacts have you never met in real life? It was about 35%. I mean, I was shocking to me personally. I guess I'm just an old fogey, but I was like thinking, oh, it would be much lower, because mostly you're going to be connecting with people maybe every once in a while you put on there someone you don't know, 5, 10, maybe 15%. But I was shocked. It was 35%. So then that led us to the question of, well, hold on. I wonder if you have more people that you interact with who are not face-to-face friends, if that changes the relationship between, if that changes your odds of having depression. And then conversely, I wonder, let's also ask people what percentage of their friends are who people they would consider very close, rather than just someone they know, an acquaintance. And what we found is that if you said most people were, for every chunk that you said, and it was 10% that you said were close, you were less likely to be depressed. So people who said, oh, everyone that I know on social media is someone that's very, very close, 80%, those people were significantly less likely to be depressed. But for every 10% that they said were not face-to-face, so the people who said 30% versus 0%, that would be this much depression versus this much depression. Does that make sense? This is a little bit of a quirky slide, but I'm trying to summarize a really complex study that one of my students did, Ariel. Okay, so why is this? Well, again, we don't really know, but one possibility is that when you know people face to face, you know the messiness of their life. You don't just see this and think that that immediately is that individual. Therefore, you might be less likely to compare yourself against that perfect ideal, because you know that this person has challenges too, just like I do. Another possibility, it's funny, I usually put another possibility there, but I'll just leave it, for that now. I probably wanted to make sure I have time for questions. Okay, positivity. What about, so the next layer in the social media pyramid, just 3 layers, is positivity. So why? Well, presumably, instead of looking at the independent variable just of how much social media you use, it should also be, what are you doing with your social media time? I mean, maybe one person is looking at 2 hours of pictures of adorable babies and puppies. And then the person next door to them is having 2 hours of hot button, discussions that are very painful and challenging about politics and religion, right? But presumably, these 2 people are having totally different experiences. And we showed this numerically with a twist that I think is very interesting. Okay, so here it is. Same kind of idea. What we did was we discussed with people how much of their experience was positive and how much of their experience was negative. And for every chunk of positive experience, their odds of depression were lower. they were about 5% lower for every 10% change in positivity of experience. But when people had negative experiences, not only was it higher, look at the effect size difference. The negative significantly outweighs the positive. Now, we know this from sociology, right? Because it's this concept of negativity bias. You're taking 4 classes and you have 3 A's and a C. What are you going to be thinking about? Right. So the issue is that how does this then affect things? And where that, I call this the Tom Holland effect, because Tom Holland is the one, the answer to the question that you had at the beginning, who said that he is taking a break from social media. Tom Holland is a uber famous actor right now, who was Spider-Man in the new series of Spider-Man, and he is just absolutely beloved. He's a extremely talented. 98%, I am certain, of the social media about Tom Holland is just how adorable he is and how talented he is and how wonderful he is. But there's that 2% that is negative, that is outweighing everything. And so he's like, I can't do this anymore. This is really harming my mental health, even though the vast majority is bad. So what does that mean for the rest of us? I mean, we're going to have some negative experiences, right? I mean, if you're on there for 2 hours, looking at various different things, that's the low end. Sure, you're going to have lots of positive experiences and lots of, oh, it's so wonderful to connect with this person. It's so wonderful to XYZ. And then there's that one thing that you said that somebody misinterpreted. There's that one gaffe, that one challenge that happened. There's that one picture of something that reminds you of something different, that triggers something else, et cetera, et cetera. It's also, forgive me if this is a little bit, on the edge, but I think it's important because the other point is that social media is a little bit like road rage. It's a little bit like road rage, especially if you don't know the other person from real life, because you're not interacting with another human, are you? You're interacting with an avatar, especially on something like Reddit, where everyone hides their identity. And so when road rage incidents happen, one of the reasons that they happen is that that's not a human being. You don't imagine your Aunt Margie in that car. All you think of is that horrible red car that cut me off and almost caused an accident. We disembody that car from a human being. Just like on social media, we disembody people. It's no longer a person. It is that mean avatar, which causes a lot of the strife that we ended up seeing. Okay, the pinnacle of the social media pyramid is creative. And again, I apologize for asking this as a question on there because I made this up, so there's no way for you to know it, unless you have read my book, where I do describe it. But what I call, and this is not creativity like arts and crafts creativity. How am I doing that time? Oh, I'm okay. Okay. Okay, so for example, how can we be creative on social media is not about how can we be more artsy, craftsy, whatever. It is, how can we be a little bit more strategic about what we do? And an example is tailoring social media use to your personality. Because as you can probably imagine, Miss Piggy is going to have a very different experience on social media than will Kermit, given their temperament, given what they are made of. Okay, so what we did is we looked at the big 5 personality characteristics, which is sort of the accepted personality assessment, especially if you want to be relatively easy about this. You can ask these in 10 items. The Myers-Briggs, yeah, it's a great instrument, but it's like 100, even at minimum. And and if anyone needs these items, I'm happy to give them to you. They're freely available too, but I've got some, and what we did was we looked at a whole bunch of different relationships, and we were able to show that it really is true that these relationships between social media use and the odds of being lonely, for example, can be completely different depending on whether you are a low conscientiousness person or a high conscientiousness person. Also, one of my students who did this paper, an undergrad. And what she showed was that among people who are high in conscientiousness, and conscientiousness is a tricky concept in this particular setting, but it's kind of like the opposite of laziness. Like low conscientiousness is kind of like, whenever, whatever. High conscientiousness is, nope, I'm going to do it now, et cetera, et cetera. And so what she found was that people who tested high in conscientiousness, there was no relationship between, they could use a ton of social media and not become any more lonely. Whereas the people who were low in conscientiousness, there was a direct, significant linear relationship between using more social media and becoming lonely, to the tune of these people are 3+ times as likely as these people to be lonely. So these things really are different by personality, and that's an example of a nuance, of a way that we can be creative with our use that we might not have really thought about before. Another example of creativity. So Kurt Vonnegut in 1961 wrote a short story called Harrison Bergeron. And in this story, it was about a dystopian future world. In that dystopian future world, people all had to be equal, quote unquote. And how they were equal was that if you were very graceful, you had to wear weights. If you were very beautiful, you had to wear masks so that no one could see, this was his dystopian vision. Okay, what did the smart people have to have done? They had little beeps go off in their ear at random points during the day so that they couldn't concentrate. Well, that's all of us every day in 2022, right? Because if you have not turned off every notification that you have, you're constantly hearing exactly those beeps. And in fact, there was a study that was done that showed that if my phone, so my phone is off now, okay, because I'm giving a talk. However, if I put it here, it is actually affecting my performance, even if it's 100% off. What they did was they had people do cognitive tests. Half the people, their phone was in another room. The other half of the people, they had them turn off their phone physically, but put it on the desk in front of them. Those people, compared with the people who the phone was outside the room, were much slower in complex tasks. I'm going to put this away so that I can't see it, so that it doesn't mess up any more in my talk. So the idea is that this is another one of those ways that we can be creative. We can really say, you know what, this turning off the notifications thing, it's not a small thing. It really is affecting potentially my mind. Where I put the phone really is an important thing. If it's by my bed is actually important. And I talk about that in the book. There are a lot of other things too. It's important to think about special populations. We showed, for example, that tremendous association, this is one of my postdocs who just got a faculty position, and she showed same thing with social media use and eating concerns related to the SCOFF eating disorder instrument, those of you who've used that before. And you can sort of see why this is. There's a lot of confusion on social media where you're getting a lot of, okay, this is really what I should be eating every day if I'm not having any of this or any of this or any of this. But on the other hand, I'm then seeing ads for this as like the American dream every day. I'm really confused. I don't know what to do. There's a lot more that I could talk about related to that, but I want to get to questions as soon as possible. Just one last thing I'll show you. So here was an example where, again, very confusing. We were trying to look for any outcome where there was a relationship where more social media use was better. So we figured, well, it's got to be loneliness, right? Because if you've got 700 friends as opposed to 40 friends, you got to be less lonely, right? No. So very complex, but probably what's going on here, yes, you've got 700 friends, but it's one of those things where you're like with everybody and with nobody. Can we achieve a healthy balance? I'd like to think that we can. That's why I wrote a book. I puzzled over that for a long time, whether it was even worth it to try to write it. But I do think we're at the point where we can start filling in little pieces, and with so many of the things that we do in all of the human sciences and all of public health, we're not going to be able to change it immediately, right? We're going to be chipping away and thinking about these things, figuring out what the next step is. Okay, so now let's do the answers. So you can tell me how much you got right the first time and how much you got right the second time. I'm hoping that now you get them all right the second time. When was the term social media first used regularly? So the answer we now know is E, the early 2000s. What is the leading cause of disability worldwide? Believe it or not, D, depression. Did anyone get that the first time? Oh, some people. Wow, great. Since 2000, the rate of suicide in the US has increased 33%. In a major national study, using this many social media platforms in an average week was linked to the best mental health. It was 0 to 2. Which of these celebrities recently stopped using social media? It was B, Tom Holland. What was the Oxford English Dictionary's 2015 word of the year? It really could have been any of these. Google is a verb, tweet, but it was, in fact, the laughing while crying emoji.
Where does it come in the alphabet?
Yeah. Oh my gosh, I love that. Where does it come in the alphabet? You know what? I'll bet it's at the beginning. You know the way they always put numbers at the beginning? I bet they put pictures at the beginning too. But how are we going to then start, when the next one comes, are we going to put it before it or after it? If it is a swirling poop emoji, where's that going to be? Yes.
They do have a code, so you can categorize them by number. It's hashtag not it's hashtag. Oh God.
An ASCII code.
Pound sign.
Yeah.
And the number.
Yeah.
So you can just put it if that works.
There you go. There you go. I love that. Thank you. Which of these is not one of the big 5 personality characteristics? It turned out to be impulsivity. Is not considered a personality characteristic. There's argument about that, of course. Who wrote this 1961 short story Harrison Bergeron? That was Kurt Vonnegut. And imagine an average young adult, what percent of their social media contacts have they never met in real life? 35%, as we mentioned. And then finally, the pinnacle of the social media period is the B, be creative. And thank you very much. So I realize we don't have a ton of time, but happy to take any questions.
Questions from the room.
Yes.
How did you operationalize social media? Is Microsoft Teams social media?
Oh, it's a great question. Yeah, and what we did was we looked at sort of formal, do you know Hootsuite, We Are Social? There are formal sort of, definitions of social media, and we selected one, and we then used their, top 11 of those social media. But here, let me give you an example of how every system is flawed, and I'm, not sure about this. One of the forms of social media that was on there was YouTube. Now, I don't really think of YouTube so much as social media, but it was like their number 7 or something like that. And so I went ahead and said, look, I've got to use, the way we always have to be as systematic as we can to have our research be reproducible and, to make it, valuable. Did I have a little bit of a challenge with that? I did, but I went ahead and I went with their definition. The others, aside from YouTube, were pretty much what you would expect. Now, there was no TikTok at the time, though. So TikTok was not part of any of this. And so if we do this again, obviously TikTok is going to be big and definitely part of it. But that idea of measurement, a great question, because those are exactly the things we need to be thinking about. What's feasible to measure? How do we do it? And what kind of systematic approach can we use so that it is most valuable for the community of researchers? Yeah, thank you. Yeah, Laura.
I was thinking about the interaction or use of social media or representation, and then the question of disembodiment, when you may have different personalities. Now, for example, my little dog Pete has his own. So it's a different personality when I go onto Facebook under Pete, and sometimes I get confused.
Yes.
Communications person. But people do go on these with very different personalities, even in a moniker. Used to be IRC.
Yeah. Laura, it's a fabulous point. And this is actually one of the major theories as to why using more platforms and more different personalities might actually be itself a problem psychologically. There becomes this cognitive dissonance almost. Who are you? I mean, it's almost hard enough just because I need to be a certain person at work. And I am trying to be, as authentic as possible as I can here. But am I different in my household with those people? Am I different with, when I get together with my high school friends versus college people versus a annual meeting, of the APLU? Yes, absolutely. We're all struggling with those kinds of who am I identity issues anyway, that all of the psychologists, Erickson especially, demonstrated how incredibly important that is for me to understand who I am. And so if not only am I having difficulty with those different roles in real life and converging those as much as possible, but if I'm also 7 other people, because on Reddit, I have this sort of sarcastic, way that I do everything because I want to get more points there and, stuff like that. But on this other platform, I'm totally different. It becomes even harder to sort of be a whole person. And that can also feed in absolutely to mental health issues. Yeah. Yeah.
This is really excellent. So it's really fun to hear you slice the data in different ways too,
Mhm.
and look at it. Is there any information about not just how much, but when you're doing it?
Mm-hmm.
The example of if I'm doing it in the evening versus at work, that's probably a different mental pattern play.
Absolutely. And Matt, that is absolutely something we need to look at more. We don't have a lot of that here. Now, the one thing that we did do, and we were able to capitalize on this, and this just demonstrates your point, that if we can look at this, we probably are going to discover some really important things. So if you look up, my name, social media, but then Levinson, Jessica, she was the first author on 2 papers, both in sleep journals. One, the Journal of Sleep Health, and the other one, Sleep, the top sleep journal. And what she showed, the one thing that we did ask is, how much social media do you use in the last 30 minutes before you go to bed? Now, we also asked, how much social media do you use all day? We unfortunately didn't fine tune it as much as during the day versus evening versus weekend and things like that. But what she found was really interesting. The first paper showed that there was a dramatic relationship between just using more social media anytime during the day and having worse sleep. Just like all the pictures that I showed you. And I could have easily put that into this presentation, but there was only so much we could do. So Jessica Levinson, really, really interesting. Oh my gosh. And so in the discussion, it's like, why is that? I mean, this is all the social media you're using all day. So how could that interfere? Is it a cognitive thing? Is it a blue light thing? All of those kinds of questions. The second analysis she did was focused on the independent variable of just the 30 minutes before you go to sleep. And she controlled for the amount of social media you used all day. And she found that there, the effect size was even bigger. So in other words, what she was showing is some things that, exactly the kind of research that we all want to do, research that really kind of can help somebody tonight or tomorrow to potentially improve their life, saying, you know what, the total amount of social media that you use probably is related to having bad or sleep problems, at least in an epidemiologic sense. But that 30 minutes before bed is particularly critical. And again, we don't know because that hypes you up, psychologically. Could absolutely be that. Could it be the blue light phenomenon? Let me just say one quick thing about that blue light phenomenon that you've probably heard of. And I'll explain the issue just for those of you. How many people are familiar with this idea? So yeah, so fair number. So I'll just very briefly say that humans are made to go to sleep when the blue light starts shifting to red light. The reason is that when the sun rises, because of parallax and because of all kinds of things related to optics and physics, the light is more on the blue side of the spectrum. But we all know that as the sun sets, it's more orangey, right? And so it becomes a little bit more red. So that signal naturally goes to the pineal gland in the brain and says, hey, it's time to secrete melatonin, that thing that we're all now taking as a supplement, when really we should just be kind of getting it naturally, seeing the sun set, and then it's time to go to bed. Okay, so what that so a couple of pieces came out, and people said, well, this is the big problem. When you're looking at a device, the device is mostly emitting blue light. And so that's probably a problem, and you're going to have a problem going to sleep. Well, what did Apple and Samsung and everybody immediately do? They gave you glasses. They also actually have it built in now. You can touch a button and it will automatically shift to to an orangey light as time goes on. However, unfortunately, that has not helped the situation at all. All it's really done is given people the false sense of security that now I can protect my mental health by just pressing this button and then having angry discussions all night to 3 a.m. And my sleep is going to be just fine because my melatonin is going to be all kicked in because it's orange light, right? So this is a perfect example of how we need to be careful in how we report these things, because part of it came from this study. Jessica very appropriately said this might be an issue, the blue light, and they immediately started putting on all these orange light things and saying, oh, well, guess what? You don't have to worry about that more. No, you do. Just, so point is, what will we see when we can look at different times of day? It's going to be fascinating. The one other thing that we did get on, that we were able to capture that's somewhat similar to what you're talking about, is frequency. We had a variable, and I just didn't show you all of the data because it wouldn't have been possible, but we had a variable about not just how much time you use social media and not just the who are you interacting with and all those things, but what's your frequency? And when we control for time and we look at frequency, same thing. So, in other words, what that means is somebody who goes home and does an hour and a half of social media in one sitting and then is done with it was much more mentally healthy compared with people who were opening every 5 minutes. And you can sort of imagine how cognitively that might be a problem. Socially, that might be a problem in many other ways that could be potentially linked to mental health.
All right, thank you, everyone.